So there are two methods to perform gene therapy. One is called the in vivo gene therapy or the direct method, and the other is called the indirect method or the in vitro or ex vivo method. Now, before we continue, I'd like to explain a few terms that I have just spoken about. In vivo means inside the body, in vitro means inside glass. When we talk about in vitro, we refer to anything that we grow outside the human body or in a culture dish. Whatever happens inside the body would be direct method, and when we go outside the body, it's called the indirect method. It could be called in vitro or it could be called ex vivo. We use the term in vitro way too often than ex vivo. You should be familiar with these terms. So in direct method, what you do is you take the gene and you directly insert it into the human body. As simple as it sounds, but it is often quite complicated. And the reason is that you don't know what will happen when you insert a gene. So let's say I pack up a gene in my vector and then I directly insert it into the patient. We've already talked about it in the first video that I can't directly insert a protein. I need to insert a gene that codes for a protein, and the reason is that I don't know if the protein is going to function or not, or if the protein is going to fold itself into the proper form that it requires to make the product. Hence, we are going to insert a gene. The term that you can see on the slide is transgene. A transgene is any gene that does not belong in another organism. So let's say if I am inserting the gene of human insulin into E. coli, the genome of E. coli does not have the human insulin gene. That gene will be the transgene for E. coli. Another complicated thing that can occur during direct gene therapy or in vivo gene therapy is the triggering of an immune response. So when you insert the vector, that vector is a foreign particle and your transgene could be detected as foreign material. So more than often, your body undergoes an immune reaction, and sometimes this immune response can be really severe that it may lead to septic shock and it can eventually lead to death. There are consequences of direct therapy, but there are cases in which you need to perform direct therapy. For example, a drug called Luxturna is directly injected beneath the retina. It is used to treat a retinal dystrophy, and basically Luxturna delivers the RPE65 gene, which restores the missing enzyme necessary for the retinal epithelium that produces the retinal pigment. Other examples of such therapies that are in clinical trials include the therapy for hemophilia A. As you can see in the image, there's a term called AAV2 vector. So we are going to talk about vectors in our next part, but keep this in mind for further discussion.